Welcome back. In your morning medical news, today marks 5 years since Chinese authorities confirmed they had identified COVID-19 as a novel coronavirus. Remember that? It was initially named 2019 nCoV by the World Health Organization. That was January 7th, 2020. It came a week after cases of pneumonia from unknown causes detected in Wuhan, China, were first reported to the WHO. Then that pandemic was declared on March 11th of 2020. The FDA wants to change to pulse oximeters. These finger device checks oxygen levels in your blood. Became a common tool during COVID, but studies show they're less accurate for people with darker skin, often showing oxygen levels higher than they really are. Now the FDA wants manufacturers to change how they test and label these devices. A new study shows instant access to medical records may be backfiring. Patients now see test results before their doctors can review them, but often struggle to understand the medical language. Researchers suggest either making reports more patient-friendly or talking with your doctor ahead of time about what to look for in the results. It is a respiratory illness that may start out like a cold, but the cough that accompanies pertussis, also known as whooping cough, can last for weeks or months. As this disease continues to surge, Mandy Gaither has a look at the latest data and how to protect yourself.
It's a disease that's been surging for months. Now the CDC says whooping cough cases are the highest they've been in a decade in the U.S., with no signs of slowing down.
And what this bacteria does is it attaches to the cells that line the airways. They're called cilia, the sort of hair-like cells, and damages those cells and creates a tremendous cough.
There have been more than 33,400 cases reported this year through December 21st, according to preliminary CDC data. Early treatment with antibiotics may lessen the severity of the infection, but experts say this disease is also preventable through vaccination.
Prior to the 1940s, when vaccinations were not that common in the United States, about 9,000 kids would die per year in the United States.
In the U.S., the vaccine coverage rate that protects against whooping cough was just over 92% for the 2023-24 school year, a decrease from the year before, and coverage for all vaccines decreased in most states.
And as this rate drops, the level of infection in the community rises. And so far this year, we've seen about 6 times more whooping cough than we did last year.
Those at highest risk of getting severely sick include young children, those with certain medical conditions like asthma, and anyone with a weakened immune system.
We can vaccinate children, and we really need to get back to sort of a sane environment where parents are really taught that these childhood illnesses are unnecessary.
Whooping cough is highly contagious and can spread for weeks after the cough develops, but some infections can be mild enough for some that they can spread the illness without even knowing they have it.